Hi, everyone. My name is Chris Burfield, and I'm here today with Dr. Joe Criscuola from Wake Forest, North Carolina. And we've got Dr. Joe on this live Google Hangout because Dr. Joe has been getting a lot of questions on Facebook, through email, through just social media posts, asking about chiropractic and ear infections and treatment, different treatment options for children that suffer with ear infections. And there's a lot of information out there, and it's causing a lot of confusion amongst parents as to, do I put tubes in my child's ears? Do I do antibiotics? Do I take a more natural route? So we've got a bunch of questions that some parents have asked, and Dr. Joe said that he would take some time out of his lunchtime today to answer these for the parents in Wake Forest. So Dr. Joe, first of all, thank you for being on this Hangout.
Oh, it's my pleasure, Chris. Thanks for having me, bud.
Yeah, absolutely. So let's get started. The first question we have actually comes from Amy, and she wants to know, Dr. Joe, my 6-month-old is currently experiencing her second ear infection. She cries all day long and even screams at times. I feel helpless, and my heart really goes out to her. The doctor prescribed antibiotics the last time we saw them, but she had a reaction and broke out in hives. Well, that's not good. She says, I don't want to go that route again. What do you suggest?
Wow, so that's pretty scary. Having a reaction to an antibiotic is every parent's biggest concern. I think that there's actually a foundation out there called the Wyatt Lehman Foundation, where some parents started to inform parents about the dangers of antibiotics. And luckily, she's okay, and it was just a rash, but it can go pretty bad pretty fast. The only way you typically know if you're allergic to antibiotics is to take them. And little Wyatt Lehman wasn't so lucky, and he died about 30 days after taking amoxicillin after complete liver failure. So first thing we want to do is make sure that parents understand that there is dangers of taking antibiotics. And, with the ear infections, one of the first things we think about is, was the ear actually infected, or was there just a fluid buildup? Typically the fluid buildup comes first, and the ear infection would come second. For looking for alternatives, there's some things you can do right at home right away. If you start to notice your child being tugging at their ear, uncomfortable. Obviously, this child's, crying all day. It's a pretty obvious sign. You want to put some moist heat on that ear. You want to massage along the side of the ear and the neck. You want to help that drainage, because the ear drains down the lymph nodes down the front and side of the neck. And so you can do some things right away at home to get that draining. There's definitely options. Obviously, without antibiotics is not an option anymore. And it's going to lead us to some more natural solutions. So, I want parents to know that there's things you can do right away. You can change the diet. You can remove some of the sugar and the dairy the sugar causes inflammation. The dairy causes the mucus to be thicker. So we want to do some things right away at home as parents. You can use some essential oils like lavender to help the child relax. And then what you're going to want to do is you're going to want to call your chiropractor. If you don't have one, you need to find a chiropractor that works with kids and go in and make sure that there's not something going on in the nervous system causing that eustachian tube to not drain properly.
I've also heard too, Dr. Criscuola, that things like natural drops with like garlic in them sometimes help as well. Is that true?
Mm-hmm. Yeah, for sure. So some parents will use some garlic drops. You can even just use like some warm olive oil. You can make your own garlic drops in some warm olive oil yourself. You can just slice some garlic into some olive oil and then just steam it over the stove. And that will help just warm that oil up with the garlic in it, and then use a little medicine dropper and put some drops in there. Garlic's a natural antibiotic. So you can go in there and you can kill off some of that bacteria in the meantime, and then we can get in there and figure out how to get that eustachian tube to drain properly.
Okay, excellent advice. Thank you for sharing that. The next question actually comes from Kelly. She wants to know, Dr. Joe, I've heard that antibiotics are not the best option for ear infections. Why? And what is the alternative?
Well, the main reason why antibiotics are not the best option for ear infections comes down to the fact that it's not addressing the cause. You see, there's a cause to the ear infection, and that is the fluid is not draining properly. And so I like to explain it with an analogy of like a swamp with some mosquitoes. You can go in and you can spray the mosquitoes with some bug killer and kill off all the mosquitoes in the swamp. But I guarantee you go back to that swamp in a month, there's going to be plenty of mosquitoes back again. And that's the same thing that's happening in that middle ear is the fluid's there, and the antibiotics kill off the bacteria, they kill off the infection. You're going to get some temporary relief, but the fluid is not drained, it's moist, it's warm, bacteria is going to come back, and you're just going to be recurring that same situation over and over again. So antibiotics are not going to get you to the place where you're finding a solution. You're just going to be treating the symptoms. And we want to get to the cause of the problem. You've got to drain that middle ear.
Gotcha. And did I also, I thought I had seen somewhere before that doesn't the American Academy of Pediatrics, they don't even recommend antibiotics. Is that right?
That's true, Chris. Yeah, the American Academy of Pediatrics has a 72-hour watch and wait protocol that they recommend to their pediatricians. The problem with that is that your kid is, like we said, screaming, crying. It's pretty painful for these kids, and parents want something. They've got to do something. And without the information out there, like we talked about that first question, what do you do? Well, now they have a handful of things. Okay, we can try moist heat. We can try massage. We can try some garlic drops. We can try some lavender. We can schedule an appointment at the chiropractor to make sure that there is proper drainage of that eustachian tube. Now you've got an alternative, but waiting 72 hours is just doing nothing is probably not going to happen for many parents. But yeah, the problem with the antibiotics being that there's so many kids on antibiotics. It's the number one prescription for antibiotics is ear infections. And it's creating mutant strains of bacteria called MRSA, which are not effective. Antibiotics can't treat. So now we're having MRSA infections in these kids, and it's going down a kind of a long road.
Yeah, that's a scary thing, especially when you think about it's your child. So right. Here's another question for you. This one actually comes from Sean, and he wants to know, Dr. Joe, my 18-month-old son has been having chronic ear infections for the last year. I think this is his fourth. Our ENT, which is ears, nose, and throat specialist, our ENT says it's time for surgery now, but we're scared. The doctor says it's a minor surgery and there's nothing to fear. But at this point, do you think surgery is our only option? By the way, and he says, by the way, the only thing we've tried up until this point is antibiotics.
Yeah, well, there's a couple of main things we want to talk about here in this question. The fact that you haven't tried anything else besides antibiotics leaves definitely some possibilities to some alternative care for that ear infection, getting that child healthy, being on multiple rounds of antibiotics. I'm pretty sure their immune system is probably not functioning well at all anymore. So we've got to rebuild most likely the digestive system with some probiotics, which is where 80% of your immune system is. So we're going to want to start working on building that immune system up, because if we just put a tube into an ear of a sick kid, there's not going to be much help. That muscle is probably pretty tight. That's pulling around that eustachian tube. The reason why it continues to get ear infections is there's a tight muscle around that eustachian tube, not allowing it to drain properly. So the problem is still there, and the child is probably still sick. So we're going to want to build up the immune function of that child, and then we're going to want to try some natural care to get that eustachian tube to drain properly. Any surgery, in my opinion, can be dangerous. You're talking about a little kid, and we don't know how, just like we don't know how they're going to react to antibiotics, we don't know how they're going to react to anesthesias and pain medicines and all the others. So we really want to put as little in the body as needed and let the body's innate intelligence, the body's innate immune system to kind of do its thing. So I recommend looking at some alternatives before that doing that tubes.
Yeah, and Dr. Joe, I will say that I've had family members that have had their kids. They've done the surgery, they've done the tubes, and the tubes fall out a lot of times. My one cousin, his little girl, she's had tubes put in her ears like 3 times now because they don't stay in there. And I'm assuming, based on what you just said, that's because the muscle around that area is so tight. And then they're trying to shove a tube into this tight muscle and it just kind of squeezes it out over time. Is that what happens?
Yeah, that's basically how it works. The muscle is called the tensor veli palatini muscle, and it's the muscle that like if you ever are on an airplane and you got to kind of pop your ears, like your ears start to get clogged and you swallow, your ears will release. That's that muscle. And what happens is that muscle just stays tight, like you can't get it to release, and that swallowing should cause it to relax. So with a tight muscle and jamming a tube into it, it just squeezes pops that tube back out, and that's why tube surgeries typically have to happen multiple times. I think it's like 40% of tube surgeries that have to be redone. But the average kid has 2 or 3 tube surgeries before it actually works. So it's not the best solution at all. And meanwhile, your child is probably having some hearing issues, and we're starting to talk about maybe developmental delays, lack of ability to learn speech and hear properly. And so you're kind of wasting a lot of valuable growth and development time for this kid while they're trying a surgery after another surgery after another surgery, and meanwhile we've got some bigger problems.
Gotcha. Okay. Awesome. Thank you for that. Great information. This question comes from, I hope I'm pronouncing this right, Kylie. I think that's how you say it. Kylie, if I'm mispronouncing your name, I apologize. But Kylie says, my friend said I should bring my 9-month-old in to see you because he's now had 3 ear infections in the last 3 months. I'm confused though. What do ear infections have to do with chiropractic?
Yeah, that's a great question. A lot of people have that same question. Most people think chiropractic is about your spine. It's about your spine, maybe back pain, neck pain, headaches. But what chiropractic is really about is the nervous system. Those 24 movable bones in your spine are there protecting your spinal cord and all the nerves that come out of it. And these particular nerves in the upper part of your neck go to your ears, your nose, your throat, your sinuses, all these things that we're dealing with these kids who have pretty much poor plumbing in that area and it's not draining properly. And so, that's what chiropractic is. Its main job is to make sure that the nerve supply to those organs is working properly so that the body's immune system and the body can to work the way it was designed to.
Now, Dr. Joe, you mentioned earlier that there was a muscle called the tinea. What was it called again?
We call it the TVP for short. Yeah, it's the tensor veli palatini muscle, but we call it the TVP.
Okay, so that TVP muscle, if a child had stress on its nervous system, you're saying that those nerves could affect the muscles in that area where the TVP is, causing it to contract, which is preventing the fluid from draining.
Exactly. Yeah. Yeah. It's a very simple way to look at it. Each nerve goes to a particular group of muscles, a particular group of organs, and a particular area of sensation that it controls. And the top few bones in the neck control the TVP muscle, amongst other things. And if there's pressure on that nerve, that muscle will be tight and it won't drain properly, and you'll have chronic ear infections.
Now, how would a child, I'm kind of confused myself a little bit, like how would a baby, an infant, have stress on that area? It's not like they've had any like major slips and falls or anything like that, like what would cause that stress to the nervous system that would cause that muscle to tighten and prevent that drainage?
Yeah, so there's three types of stress. There is physical stress, which is most common in little ones, from anything from in utero constraint, like when they're in the uterus, you know, kind of pre-birth and that birthing canal, and they start to go head down, and they're kind of, you know, can you imagine just doing a headstand for the last 3 months, for like 3 months straight, right? Your head's down completely, waiting to be birthed in that pelvic canal, and the head can be tilted one way or the other, kind of jammed in there unevenly, creating some stress in the spine, right even before birth. And then the birth process itself can be pretty traumatic. You know, the average delivery, even vaginal delivery, they use about 60 pounds of pressure to pull the baby out. So picture like one of those 45-pound weights that are at the gym, you know, those big plates, right? And tie your baby's feet to it, and then pick up the baby by the head with the weight with it, right? That's 45 pounds of traction.
Wow.
We're talking about 60 pounds of traction that we're using to pull these babies out on the average OB, and that's a non-complicated birth. You know, that's when everything's going smoothly. And so a lot of kids, when we do the consultation with the parent, we find that their birth wasn't smooth in the first place. It was actually even more traumatic than that they were stuck, or that there was complications, or maybe it was a C-section where they use even more force. So we've got a lot of things right off the bat that are kind of putting some force and stress on the neck.
So you're
and then
saying
you've
that
seen the baby.
with a C-section, the force can actually be even more than a vaginal birth?
Correct. There's actually more force on a C-section used, because now you're pulling the baby through a bunch of organs. You've got no contractions in the uterus. The mother's not helping at all, and that can be a big contribution to having more stress.
Wow. So that would kind of make one more thing before we go on to this last question. At one point, didn't you tell me that approximately 80% of all children experience an ear infection within their first 2 years of life, and 50% within their first year, or something like that?
Yeah, those are the current stats right now. So, you know, it's pretty common. It's the #1 reason for visits to the ER for kids under 3. It's the #1 prescription written for children. And so, yeah, it's a huge problem. It's very common. A lot of problems come from the birthing process besides ear infections, but you know, I think it's something that has to be addressed. I highly recommend that parents get their children checked right after birth or soon after birth, to prevent this even happening in the first place, and making sure that there is no stress on the baby's neck. And you know how they do, right? When they hand you your child, they're gonna, hey, careful with the neck, right? And you're passing your baby around, the last thing you want someone to do is let your baby's head fall back. But I mean, think about how important it is to control that neck. But meanwhile, they've already yanked on it, twisted it, turned it to get this baby out. And so we know how important that can be.
Good point. Very, very good point. So this last question comes from Jeannie, and she wants to know, Dr. Joe, our family doctor referred us to a local ENT, ears, nose, and throat specialist, because our child has been suffering with chronic ear infections. The ENT told us that the reason our daughter's having these ear infections is because fluid is building up in her inner ear. He said that he can place tubes in her ears and drain the fluid, and that will solve the problem. My question is this procedure safe? The ENT says it is, but I've watched some videos on YouTube and it makes me a little uneasy.
Yeah, wow. So not surprised there's videos of it on YouTube. You can find a video about just about anything, huh?
Right.
Yeah, I wouldn't want to watch that video either. You know, when you're cutting a hole in something, to me, I'd rather the body work the way it was naturally designed to. It's completely unnecessary to go and do tubes, and with known effective solutions. I find it, very unnecessary to take that risk. Like I said before, all surgeries have risks. You've got the risks of reactions to the medications, to the numbing agents, to the painkillers. You know, you've got scar tissue that can build up in the ear canal and cause permanent hearing loss. So there's definitely risks. Now, they do a ton of them, and they're probably really good at it because they do so many. But, you know, we don't want to take that risk if we don't have to. And we highly suggest that you look at a more natural solution first. You know, like you always want to do the least invasive procedure and move your way down if you have to, but you want to start with some more natural things so you don't have to take those risks. You know, there are very little risks in all the other things we've talked about.
Awesome. Wow. Tons of great information. I'm sure this has helped not only these parents with their questions, but I'm sure there are a lot of other parents watching this right now that may have had the exact same questions or similar situations going on in their with their own child. So if people watching right now want to get more information from you, or if they want to contact you and maybe schedule a consultation to bring their child in so you can sit down with them and do an evaluation and find out what's going on and how you might be able to help, how can they get a hold of you? What's their next step?
Yeah, I mean, I'm more than happy to do a consultation over the phone. We have a lot of parents that just want to talk about, you know, have their specific recommendations or a specific case talked about. So yeah, give me a call. You know, you can call us at the office here at Heritage Chiropractic. It's 919-453-0367, and my staff will set you up with the time where you and I can chat, and we can find out if this is a solution that maybe will work for you and your child. And I can go through and do the consultation, and we can do the health history and everything right over the phone. And then all you have to do is bring your child in, and we can run those nervous system scans. You know, if you check out our website at wakeforestchiro.com, there's some great information about what those scans are and how the body works. And we have a lot of different things that you can probably tap into, webinars. I did a podcast called Health Hero about ear infections, where we talk about it more in depth. So there's a lot of information out there, and I'd be more than willing to share those resources with you. Just give me a call, and we can get that information in your hands.
Okay, that's awesome. So that's really good to know. You actually do an evaluation where you will run a nervous system scan on the child to see if there's interference to the nerves that might be causing that TVP. Is that what it's called?
Right.
So you'll run a scan to see if there's nerve interference causing that muscle to contract. And I take it that test is non-invasive. It doesn't do anything to the child, correct?
Yeah, we're measuring skin temperature, and we're measuring electrical activity in the muscles. Doesn't put anything in the body, doesn't take anything out, gives us immediate answers. I go over the answers right there on the spot. There's no dragged out process. I'm going to tell you if I can help. You know, if I think I can help you, I'm going to tell you how long it's going to take. I'm going to tell you what your investment needs to be to get this to the goal we need to have. If I can't help you, you know, I'm not going to waste your time or your money. I'm going to tell you that I don't think this is the chiropractic issue, or that I think there's a better solution for you. And I'm going to make sure you get to the right place or in the right hands.
Okay, excellent. One more time, just your phone number one more time, and then we'll end.
Sure, yeah, it's 919-453-0367.
Awesome, and it's Wake Forest Chiro, CHIRO.com. So, Dr. Joe, thanks for being on here today. Thanks for taking time, like I said, out of your lunch. I know you've got a ton of stuff that you could be doing, but dealing with patients' charts and whatnot. But you wanted to get these questions answered, and I think that was really, really awesome of you. So thank you again.
Yeah, you're welcome. My problem, you know, my pleasure to do it. I love getting this information out there, and I just really hope, you know, if I can help one kid not suffer through one more night, then I feel like I've done my job, and it's well worth my time.
Fantastic. All right, well, everyone,
Thanks.
Thank you for tuning in, and we'll see you soon.